Good afternoon, everyone. It's Chris. I am so sorry I don't have my camera on today. I'm on a different device and my camera does not always work. And it's another discussion for another day. Today, we're going to talk about infection control, and this is week 5 of 8 weeks. And I know that I've received tons of emails from everyone. Thank you so much for all the positive feedback and the questions that you have. I will stop the recording at 5, but I will stay on for questions. The week 1, 2, and 3 have been released. The information is on YouTube and it's on a link on the website. And I'm not sure that week 4 has been, but it should be by the end of today. So, and the reason I say that is for those that want CEUs. Sometimes there is a delay because I do edit the information that I'm providing to you because I streamline it. And speaking of that, with regards to this presentation, what a party in my brain. I just don't have enough time to give you everything. I'm going to go a little faster than normal, but this is a lot. And I'll probably, after the 8 weeks, I'm going to, I think I mentioned this before, I'm going to go back and do the actual ROP requirements because that's where this crossover came on infection control, infection prevention. So with that said, let's get started and making sure that everyone can hear me okay. Maybe a thumbs up in the chat because I am on a different device and I want to make sure that the sound quality is good. 2 participants raised the hand. I don't know if I have to, let's see what I do there. Maybe the hand is, good. I don't know. I don't see the hand, but let's see, we'll keep going. Thank you. We hear you fine. Thank you, Lori. Thank you. Good here. All right. Thank you so much, Peter. All right. Thank you for that. Great. And I will be on remote on next week as well. I'll be traveling. Okay, let's get cracking. That's, I always put like fiscal year 2023 because as time goes on and you have access to information, you're going to get yourself grounded on what year you're talking about. So ROP, requirements of participation, F943 is the infection control tag training. Now, I did something different for you guys because I took the angle of how are they training the surveyors to looking at infection control, and that's why I went a little bit down a rabbit hole. But I'm going to cover both and the key elements, but I do think this is of value. Thank you so much. Okay, very good, very good. Thank you, thank you. I don't know how to do raise your hand yet, so if you raise your hand, I don't know, adjust it. That's me. And planners, great. Okay, so then I like to bold out infection control this week, compliance and ethics training next week, then nurse aid training and behavioral health. But infection control is where we're focusing. And that's today. Great. Okay, what are the goals and what are the learning outcomes? And this is fully packed. I want you to know what the 8 elements are for infection control. And I'm sure many of you don't know what they are. And just to understand that global understanding, I want you to understand what the government wants to be sure that you have trained your individuals on. And of course, I have to throw in identifying the difference between standard contact, not contract. And this is where, because I do my run here, and this is where I make notes, contact precautions and airborne precautions. So that you will know that off the top of your head. There are many nurses that are sitting on this call right now, and there are many nurses that know this. But I also know that many nurses became confused during the height of the pandemic because there were different rules that were applied with shortages. I am going to have a discussion on that. But overarching, do you know the difference in these types of precautions? Now, before I get going, I'm going to see this 8 elements of infection control. There they are. And I'm going to review them quickly, because I'm going to get to some other stuff that I think is not more important, but the specifics of what surveyors are looking for. So minimize exposure. That means that you are mindful of the fact that there is an issue happening and you want to mitigate or eliminate any exposure. So in the context of minimizing exposure, you would not have people that are sick work. You would have different workflow patterns, or people enter one door and come out another. So again, very simple. Could do an hour in each of these, but just a simple understanding. There are 8 elements of infection control. Adhere to precautions. You're going to stick to the script, meaning wear a mask, don a mask, doff it, put it on, wash your hands, use anti-ABHS, whatever it is, you're going to make sure that you are sticking to the precautions. 3, movement in the facility, visitors, staff. You have a separate unit, right? So you're isolating, they're coming, you're managing their access when they come, where they walk, do they leave the room? We talked about this a little bit last week with the resident rights, because remember now, resident rights, there was a change in September of 20, not a change in resident rights, but there was a big change in when people can visit your facilities, and now they can visit anytime. So number 3 is the flow and movement within the organization. Engineering controls. In other words, do you have a system in which the air is recirculated within your organization? One of our clients in the New England, they had the rooms, they had the rooms reconfigured with a phenomenal maintenance engineer, that the airflow was not used over, and they had stuff that went out the windows. In other words, is the air being cleaned? Is it coming through the window? Is it all using one system? And that would be an example of engineering controls. Monitor and manage ill and exposed staff. This is your data. This is your, when we talk about the role of an infection preventionist, they have a very expansive role. And because again, it's about contact tracing, who has it, who doesn't, who is exposed, monitoring and managing, the names, the players, their symptoms, and exposed staff, so you can see if there's a pattern, a mechanism to prevent it. Educating and training staff. That's why you're here today, because you're life learners and I've got to learn this stuff. But training is not just sitting on the Zoom, which is great. I do think Zoom has a phenomenal platform for people to engage and have gain knowledge, and that's why you're learning it faster. But it also entails identifying that they were trained academically, and then what are the follow through so education and training is educate, you have the knowledge, but I might have to have training to execute or implement it. I always talk about, during the height of the pandemic, we were all over the country and we were doing infection control. We were doing audits for the government, but we were also doing consulting for facilities. And those facilities I had 2 facilities that were under the same owners, phenomenal company, but there was just like a big gap in the execution of infection control. And I noted that, again, it took me a while. The nurses, cued me in on this one. They said, Chris, this building has less senior CNAs versus this other building. And as I said in one of the Zooms, I said that when you have seasoned nurse assistants, they are more apt to coach the mentor the younger ones and say, don't forget to wash your hands. And so if you have a lot of turnover because the community of CNAs that work for you have retired, because they're like, what, I'm just at that age, and they maybe have the option, and there's a turnover, you have to consider the actual training portion of it, because you are what you hang with. And if the team is going to share knowledge, and if they're going to coach, very important to have that execution. Okay. Okay, so let me just move the thing. Implement implement environmental infection control. What does that mean? That means that, oh, did you wash the table, the bedside table? Did you wash the bed? Did you clean the floor? What products did you use? Now, I have the periodic table in my kids' activity room. I love organic chemistry. It's a very difficult course. It's because it's, the molecular level. And, I've always been, I'm going to say, somewhat of a clean freak. And my eldest daughter is hyper focused on it. And I'm like, well, why do you like this? And she just looks at me and says, because of you. And I'm like, yeah, you're right, because of the molecular level is so important. A fun fact, if you ever heard uncle, aunt, or even yourself say, oh, the 3-second rule, right? Something drops on the floor. And if you pick it up in 3 seconds, is it dirty or not? Well, I had to be the chaperone 3 or 4 years ago for my daughter, and they went to the Peabody Museum in Cambridge. And of course, it was like run by Harvard and affiliated with MIT as well. And in this museum, they had like a fake kitchen or a kitchen, and on the wall it said, does the 3-second rule apply? Okay. Now think about this for all of us that grew up with the 3-second rule. But they also said, what is better, carpet or hardwood? And of course, my whole life, I've always been told that, hardwood is cleaner and our tile is cleaner. Well, guess what Harvard and MIT found? That actually carpet is cleaner. And the reason why is because at the molecular level, it's harder for the bacteria to move. So I thought that was a fun fact that I would share with you from the Peabody Museum in Cambridge, of which these individuals, when we walked in, they had us all sit on the floor in this like transition room, and they explained to us how important it was not to bring food into this entire museum because of rodents, and just that one speck of a crumb could cause a rodent. Okay. And then number 8 is establish reporting within the facility to public health. It's your reporting system. So these core elements are not new. They've been around for years. The CDC has them. And I wanted to introduce you to them if you didn't know them. And I wanted to reinforce them if you did or you did not know them. Great. Okay. So that's like the key element there, that that there are 8 elements. And okay, now, so when the surveyors are coming in, now remember, now the tag for that you had the proper training is F943. Did you train your individuals, your staff, all staff on infection control? When they come in to investigate, they're going to be looking at all of these, which have and I'll fill them in before you get the final: antibiotic stewardship, policies and procedures, all of the things that fall into it. And a very important facet is that don't forget that staff includes not just your employees, but any licensed practitioners, any students, says adult students, trainees, volunteers, any individuals who provide care, provide services, treatments to the residents that are under contract or by another arrangement. So anyone that walks into the facility must understand the rules of engagement when it comes to infection control. So let's see. And globally overarching themes that your program is facility-wide. It includes all departments. Again, you sort of see the essence of this tag and this area, and that the procedures that you have for anyone coming in, entering, and how you screen them, okay, are modified to accommodate the most current CMS regulations. And I found this fascinating because in the survey guidance, it's basically saying that, hey, we know that we've changed things quite a bit. So please make sure that everyone is doing and practicing at the most current the most current level of, the current guidelines. I say that to you with a chuckle, and I'm not laughing, but I'm chuckling, because what I'm saying is that they're acknowledging that there has been so many modifications. And that's one of the things that I think is a full-time job is, okay, for example, the requirements that came out on December 7th of 2020 then were rescinded on 9/27, and then they were rescinded on 10/7. You follow me? That's something else that I'll be talking about, not today, but another one. But I have those regulations, and those regulations are talking about the usage of, testing. And so keeping it straight is a full-time, it's a lot, but we're here to help. So let's see. Okay. If I might go through other things that I'm going to skip through because I have to. This has 400. You will. I keep it to about 60 to 90 to 100 for each hour. So I haven't vetted through it yet, and like I said, it'll be ready within a couple days. What are the surveyors going to look for? They're going to look to know that the staff, again, the staff. Who are the staff? Everyone in the building, anyone that comes in, contractors, under arrangement, contractual arrangement. They understand the difference between standard and contact, standard, and transmission-based precautions. They're going to look at the coordination of resident care for patients with COVID-19. They're going to look that you have standards, policies, and procedures for infection prevention and control your program. Surveillance is a good word. Surveillance is talking about the fact that whoever the designated individual is for infection control and infection prevention, that part of their role is surveillance, and that feeds into reporting, but identifying, what's happening. Is the community at high level? Or maybe the community is not at a high level, but maybe a neighboring nursing facility is. Surveillance is monitoring your surroundings to see what's happening. You could be COVID-free, but the transmission rate in your county might be high. So therefore, you have to be mindful that if the transmission rate is high, you have to follow certain procedures. They're going to look at, the surveyors are going to look at how the visitors are entering. How do you handle the visitors when you're in when you're in a outbreak or not? They're going to take a very strong look at staff and resident testing for COVID-19. They will be looking at, and I'll get to this too, but they're going to be looking at charts of patients, and they're going to be looking at staff who have had COVID or was suspected COVID and how you handled that. They're going to look at how you reported the information. You're going to look at your water management. And we talked about water management last week afterwards, because with regards to water management, the water is a highly transmissible, it's a conduit is the word. It's a conduit for infection, and that you have the ability to spread bacteria very rapidly in that. So if you have fountains, you have water bubblers, anything of that nature, how you're managing that, cleaning them, your laundry services. Do you have the antibiotic stewardship program? And they will 100% review a record of one resident who is receiving an antibiotic. Do you have a deemed and dubbed infection preventionist? What is your status on influenza, pneumonia, and COVID immunizations? And they're going to sample at least 3 staff, okay? At least one who's confirmed with COVID-19, or maybe they had signs and symptoms that were consistent with the illness, and they're going to assess to see what your compliance is with preventing this spread, from an exclusion of work, how you tested, and how you reported it. So 3 staff files. So where do you write what you do? Where's your plan? Where's your procedure? Now look, I'm going sample staff, sample residents. And the residents that they're going to be looking for. And the purpose of this is to determine your compliance with obviously infection control processes and standards, and that you're following the transmission-based precautions, and as well as how you screen, how you test, and how you report. There's a lot here. They will look at least one confirmed COVID-19 resident with or without, with positive or with signs and symptoms. And they also are going to look at a resident that has transmission-based precautions, but not for COVID, but for another reason. So the residents, they'll also look at, this gets a little confusing, they're going to look at 5 residents, and I don't think it's 5 for influenza. I think it's 1 for influenza, 1 for pneumonia, 1 for COVID-19 immunizations. Now, this is all for immunizations. And second, sorry, anyways, I wanted to fix that slide, but move you guys, you're going to move you. Okay. In other words, we're going to look at the immunizations and your accuracy. And this is probably one of the easiest things for you because of automation, but for the residents, it is. We're looking at that as well. Now, the COVID-19, they are going to hyper focus on unvaccinated residents. And if there's less than 5 unvaccinated, they are going to review every one of those unvaccinated residents before they look at anyone else. And then they will do an audit on and then the vaccinated residents. So the sample that they're going to look at. And they'll proceed on to staff. They will look at 8 staff members, 4 that have contracted it. Okay. So 4 staff and 4 contracted staff for the COVID immunization, because what are they doing here? They're looking to see if those that had COVID had the vaccination. So again, just to give you, again, I'm Twitter on steroids today a little bit. We're going to have a lot of discussions about PPE, and they have been reminded not to come down and cite you or give you a tag if you lack PPE, as long as you are making efforts to obtain that. So we need to pause here, and I have to have a conversation with you because it's so important for the nurses on the call that you were trained way before COVID-19 on proper contact precautions, etc. And one of the things that happened during the pandemic that I believe turned many states, but one specific state upside down, is the asterisks for the supply shortage. So if you have a shortage of PPE, personal protective equipment, such as gowns, respirators, masks, there were regulations that came out that said you can do a couple of things. You could reuse them, you could go from room to room, etc. And all of these recommendations were in an effort to help the healthcare organization, just meet the needs of the residents. So, but I have to say this to you, that it is never a good idea to wear the same gown from room to room. And the only time that these will be applied is when there's a shortage. How do you know when you have a shortage? You have to establish a burn rate. A burn rate means, let's just say I have 10 COVID isolated rooms, and I'm making these numbers up, 10 times a day, someone is going to go in, and I'm just doing 10 because it's easy math. So if I have 10 patients and every 24 hours, someone's going to enter another room 10 times, that is 100, right? So 10 times 10 is 100. So I know that per day, I need 100 masks, 100 gowns at a minimum, and 100, give me a second. Did I say gloves? Gloves, gowns, surgical masks, right? And that, but if I have 500 gowns, respirators, and masks sitting in my basement or my administrator's office unopened, I do not have a shortage. So you cannot follow the guidelines of, I'm going to wear the same outfit all week long. And until you identify that you do indeed have a shortage. Now, this also applies to, you might have reusable gowns or you may have disposable gowns. And if you have gowns that are being washed, there is a time frame. You can wash them about 72 times. And then after that, they're no longer useful. So there has to be a mechanism to be able to track and monitor the washing of the gowns. If they're disposable, there better be a disposable can, that's a better word for it, to doff and ditch before I walk out the door. And I'm going to show some more slides that get into these details. So donning and doffing the PPE is going to be a high focus of the surveyors. Your training, and this is part of it, because understanding that when you should never walk from room to room with the same items on. And unless there is an emergency with regards to supply, and in order to proclaim that you have a supply shortage, you must calculate a burn rate. And that means that it's not, and you don't have to be super mathematical, but you have to just figure out how many items do I need in a given day? How many do I have in storage? So this is to me a hotspot. And because all over the country, there was a misperception of, I can wear this on the unit. Let me go here with you for a second. Another incident or instance were that individuals would hang their gowns on the hook and they'd have a different gown for each patient, and that the nurse or the care provider would don it when they went in and out of the room. And that is far more risky for the care provider than it is for the resident, because you're donning and doffing it and leaving it hanging there, and there's more risk for the staff to get sick. It's just still not the best practice, because you could mix up your gowns, you're letting it hang there, the ideal situation is that you are donning and doffing a brand new gown before every interaction with a patient. So that is, and again, wearing them in the hall, I want you to think about this. In the world of infection prevention, there's a concept of clean and dirty. If I have a unit that has one COVID patient on it, it is dirty. So when I envision myself walking onto that unit is dirty. So if I am bringing, let's just say, a tray of food, and I walk on the unit with that tray of food is now dirty. And if I just whip it off and bring it down to the kitchen, I am going to expose other dishes to potentially contaminated items. Now, it gets a little tricky. When I walk on the unit and there's one room that has a positive patient, that room is dirty, but the hall is clean. So in other words, when I leave that room, I'm getting everything off of me and I'm going into a clean hallway. And the concept here is that when you think clean and dirty, that you are ensuring that you do not transmit molecules that are infected, because you're following these basic practices. So even though I said to you that whole unit is dirty with one room, so I'm not going to walk out of that room that has one exposed patient and go into my clean hall, even though I said to you earlier that the unit is dirty in the building. right? Because I had to make my point that unless I have what I call a transition room, oh, okay, here's my tray. I'm putting it in the transition room, and now I'm going to bring the items to the residence, but I'm going to go back to the transition room before I go downstairs, because that would be lead to a potential exposure. So if this particular line is that you will not be cited if you have low supply or you have a burn rate that doesn't afford you the ability to use new equipment every time. However, you will have to prove and show that you have exhausted and all resources and that you are taking the appropriate steps to obtain PPE as fast as possible. So in the concept of infection prevention, what other surveyors are going to do? I'm going to tell you with my 20-80% principle that what is the number one most important infection prevention task that you can teach every employee? Does anyone know? It is hand washing. Okay, so wait 1 second. Someone said the chat was disabled. So, fun fact. Okay, great. Let me just okay, so so if you are using the chat, I do see you, and that works. Anonymous attendee, you had mentioned reusable gowns can be used 72 times. You get it on the label of the gown. The manufacturer will tell you how many washes the gown has before it's no longer usable. An experienced, give me a second, laundry, laundry and maintenance individuals, they know this. I toured multiple COVID positive buildings across the country, and the laundry staff and the laundry director are very aware of this. Yes, I will answer any administrative stuff at the end, but if you ask me questions related to what I'm speaking for, I will send this to you as well. And hopefully, Mia W, I am talking, so hopefully you can, and the chat is working, so you're good. All right. So let's keep going here. I'll look at it every 5 minutes. Hand washing. Why did I say hand washing was number one? Because it's the number one tag. And I told you about the $2 million hand washing incident. And the $2 million hand washing incident was when the facility was in the mode of developing their plan of correction from a prior survey. And the infection control survey walked in and they found a hand washing citation on a Wednesday. The facility submitted their plan of correction on a Monday, and the plan of correction was accepted. But the hand washing issue and citation negated the acceptance, and they fell into a DOPNA, which is a denial of admissions on denial of payment on new admissions. And that one hand infection cost the building, I would say it was between $1 and $2 million. We can talk about it another time. The hand washing, I bring this up because you have to wash your hands very frequently. And as you can see, it says cough etiquette. Cough etiquette, I am coughing into my arm. I'm not coughing into my hand. I'm not coughing without covering my mouth. Our staff understanding the disinfectant protocol. Are you using the correct disinfectants? Are you cleaning, maintaining, listing, putting a list of when was this bathroom last cleaned, when you see that written out? It's the whole process. When I was again, I told you I'm a bit of a neat freak. I mean, I'm not over the top, but I'm neat. I'm not, but when I was in traveling, I was in Hawaii and during the pandemic, and on the news, they had the local airport, and they were showing all the workers cleaning the railings and all of that. And, you saw it in Atlanta, you saw it all over. And I'm thinking they should be cleaning, everyone should be cleaning this way no matter what. In other words, this isn't just COVID, it's about all types of bacteria at the molecular level. So when it comes to your what do you call them, blood pressure cuffs, your any items that are going to go from one individual to the next, is there a mechanism? Now, ideally, you want to get staff designated items if you can afford that. And that will lead into a very, very big discussion on the nursing facilities and how, again, you were not built to handle COVID-19, and there needs to be massive lobbying to get you the resources in order to serve the senior population, because there's a big risk with individuals not having places to go. And this is going to be, it may not be super, obvious right now, but I see it across the country through many, many states, many nursing homes not admitting because they do not have the staff, and the senior is in the hospital or sent home unsafely. So we'll go there. That's a tangent. That's a Chris tangent. The environmental cleaning and disinfecting, reprocessing of the same equipment. Again, what we're doing there. Now, let's talk about, this actually was something that when I read the regs, I said, I'm not sure I knew this one exactly. Appropriate hand hygiene practices. Now, what is that? Well, you wash your hands with soap and water, and you're rubbing them underneath, and that those damn faucets that giveth and taketh, the ones that are automatic, well, they in the airports, they're actually a detriment because they do not stay on long enough, or the soap doesn't come out. But anywho, the surveyors are specifically looking at, are you using soap and water when hands are clearly soiled, like they can see that stuff is on it, or the care provider is servicing a resident with a known or suspected, infection. An example is C. diff, right? Or, norovirus, during an outbreak, or if there are endemic rates of C. difficile, that's the acronym is CDI. Fun fact, ABHR is not appropriate to use under those circumstances. I don't know if anyone, is that new or is that old? Because I may have missed that memorandum. Although, obviously, I think that we all would train. I think ABHS would be more often used when you were in the hallway, in other words, but I am going to double check that one. So I'm going to see, someone did chat me because I know that. Let's see. Maybe I'm going in the wrong order, but if someone did, good. I don't know. Forget that. Okay, good. Someone did just give me a little note. So I wanted to know reusable gowns. I will get you the list. Thank you. Okay. So needless to say, it's hard for me to do both at the same time. I'm going to just say that. Let's go back. Okay. So ABHR, that's alcohol-based hand rub. That's that the acronym stands for. So what are the surveyors specifically looking for? Even if your gloves are being used, before you touch and after you touch the resident, you are washing your hands with soap and water. I'm going to take the previous slide and I'm going to apply it, because I do not know the intention. If it's confusing to me, it would be confusing to the surveyors. So I'm saying that if before and after contact with the resident, hand hygiene, and that $2 million hand washing incident, the person that came into the resident's room came in to do blood pressure, and they did not wash their hands in front of the resident and the surveyor. So at the end of the day, make sure that when you're washing your hands, and you might notice it when you go to your own physician, that they will wash their hands in front of you. Take notice if you haven't. So before you touch the resident, after. So let's just say you're going to put gloves on. You're washing your hands, you're putting the gloves on, you're throwing the gloves away, and you're washing your hands. Now, after contact with any blood, bodily fluids, or contaminated surfaces. That's not even the patient. So if you go in to a room and you take that tray and that patient has tissues all over the tray, you touched it. Molecular level, washing your hands. After object surfaces in the environment, after removing your personal protective equipment, you have to wash your hands. You touched your mask, you touched everything with your gloves or ungloved hands. So remember now, we're going to take those gloves off, we're washing our hands before performing a procedure. And whether it's aseptic, right? The insertion of an invasive device is a catheter, manipulation of a line, anything, the context here is if they're talking about touching a bedside table or, tissues, it's everything and anything. So don't have a false sense of security with the gloves, number one, and don't have a false sense of security on the type of care. If you're touching an item or the resident, whether they have bodily fluids or not, you're washing. So, here's another bonus one for you. And you may know this, but again, you want to know what they're focusing on because they're being trained. So, and they're like, okay, what are the new rules? It's just as hard for those surveyors, by the way, as it is for you, because they have to learn them to apply them. So they're going to be hyper focused on, did the resident perform proper hand hygiene? And how did you remind the resident to perform proper hand hygiene? Do you have, visual signs? Do you have, mechanisms that you're constantly reinforcing it? And they're going to interview staff. And let's just say, you can observe, you can look at a medical record, but trust me, the easiest thing to do is interview people. Because when you interview people, I'll tell you this, when we do compliance, what do I say? I can know in 30 seconds if you have an effective compliance program. All I need to do is walk into your building and say, hi, who's your compliance officer? And if no one knows, you don't have an effective program. So what are they going to do? They're going to, so now you want your staff to be audible ready. And again, what I mean by audible ready is let them know you're going to be interviewed. People are going to come up and talk to you and ask questions. They need to be able to cite it and be very confident. Yes, we wash our hands every time we touch a patient, in between, before and after wearing gloves. We're washing our hands after we take off our PPE. And everyone has to, again, constant reinforcement. And again, if there's a mechanism which you have a real loyal staff person who can be that surveillance, that oversight, someone that's, just constantly in a very kind and caring manner, coaching people, don't forget to do it. And I get it, because even with the AB, the antibacterial, you guys get it. Your hands are cracking. They're cracking because you're washing them so much during the day. They are just, it's hard. So, but knowing that it's the number one citation for a survey, and it's the number one cause of transmission, that you have to make sure that it's, again, I'm giving my 20/80. I wear 20% of my clothes 80% of the time, just as you do. So they're going to determine if the staff are using it appropriately and discarding of the PPE, and you're wearing gloves if there's any potential contact with the fluid of mucus, vent, trach, suctioning, any colostomy bags, any IVs, any but just bloody fluid, mucus. That's mucus membranes include the nose, the mouth, open areas, skin, right? So they're worn if you're going to do that. And I get it, during the pandemic, if you went for a massage and so they, they would use gloves. Oh, like, like if it felt like the worst, right? There's gloves. So there were very seasoned care professionals that, they're just rock stars and they wouldn't wear the gloves because they know there's less human, interaction, unfortunately. And I get it. I totally get it. But at this point, the wearing the gloves is, you have to wear them. And again, for precautions as well. But I understand those, that I get the mindset of those that, maybe didn't always wear them and that they are removed. Even when during the pandemic, people were wearing gloves to the grocery store. And again, someone who was pre-med, OT and loved the human body, you grocery store and you see someone use the gloves. They put their food in, they put their hands on the carriage and then they wipe their face. Then they use this, they're wearing the gloves and they go and they then put the steering wheel, they touch it. And then 10 minutes later, they take the gloves off. Well, the steering wheel's now infected. If you're going to use gloves, use them appropriately. And they're removed as soon as you have any touch with anything, and they're changed, and hygiene is performed before moving from a contaminated body site to a clean body site during resident care. So let me say that again to you. Now, again, this is right in the regulations that if you are performing something on a resident, and I get it, nurses, it is stressful. They're watching over you, especially if you're doing a wound change. They are going to say, are those gloves changed? Right? And did you wash your hands before moving from, let's just say you did an area, a stage 4 coccyx wound care, and then you were going to go now do something else, that you took everything off and then washed your hands before going to do something else with that resident. And so there are, okay, so the question that just came in, do you know of any resources where videos of proper hand hygiene and other infection, available? So there are tons of videos out there. And so the example, for example, a video in which a staff member goes to pick up a contaminated tray and shows the order of actions for PPE, hand washing and hand trailing once back at the kitchen. So yes, I can send you those, but I can tell you right now that the CDC has them. And but the other thing too is that when it comes to educating and training, wherever you're located in the United States, there is a culture associated with learning, and it does vary, I will say. And the fact that you are all on this call, and I think it gets big, more and more, and I'm very grateful for that. I'm just glad that my efforts are, you guys are, utilizing it, and grateful. But the key is that you really have to figure out your audience, because don't get fooled with hey, here's a video, watch it, because I think that there has to be an element of human interaction. But don't misunderstand me. I'm all about videos, but there's a process. So that, and I'll find those videos for you for sure. But they also how current are they, or how applicable, and how much you can hold the attention of the individuals. I am not by any stretch of the imagination saying that you need to do the same, that it wouldn't work, but I'm just saying that know your audience. And so, all right, make sure that I'm in the right spot here. Very good, Kristen. Okay, good. The isolation gown is worn for direct resident contact. And so they're going to be looking at when you wear the gown and when you don't wear the gown. And this is just going to lead into the 3 levels of precaution: contact, airborne, right? Where's my transmission based, etc. So we'll go through those as well. But, nose, mouth, and eye protection. And I think the biggest takeaway from this section of the regs is that if you do not know what the individual has, you are going to use the most restrictive precautions. In other words, when COVID first came out, I had a friend at Mass General, and the friend was negative for COVID, but the friend had been exposed, and the I'm not making this up. The people wore hazmat suits. Now, this is right in 2020 because of the fear of what could it be. So, in other words, make sure that if you have, there's an issue, but you may not 100% know what it is, you're going to, the surveyors are going to say, what are you using? Are you covering your mouth, your nose, your eyes? Are you wearing a face mask? Are you wearing a shield? Right? What are you using? And also, it's not just the diagnosis of the patient, it's the co-diagnosis, because a patient may have an issue that is only secreted through, membranes, but they're a vent. So you have to know the story of what you should do. You'll never lose if you do the highest level. They're going to hyper focus on source control and what is being used with regards to national standards. And when you have one COVID patient in a building, you have an outbreak, my friend. And whereas if it's the flu, I think you need 3. But are the staff wearing appropriate N95s that are equivalent or a high level respirator when is COVID present in the facility? And is it appropriately discarded? I have to say, again, no judgment comes from me, because those that are on this call, I know that you are the highest of dedicated individuals, and your whole mission is for the senior population. And as am I. And, let's not forget the fact that everyone ages. So that at the end of the day, that this was a real, how do I say this? What is it? A fast learning curve for people across the country, across the world. One of the biggest areas that I saw during an outbreak, that there were actually no, and this is the word I'm looking for, it's the disposables, receptacles. That's the word I'm looking for. Every room should have a can with a cover that prior to an individual leaving, they can take off any PPE, because it needs to be appropriately discarded. Because remember now, the hallway is clean, the room is dirty. So I come out, I have to doff it. But once I walk in the hallway with my PPE on, I'm now potentially infecting the clean hallway. So prior to leaving the room, now it says, except in the case of extended use. And this is where it gets a little tricky. You have to do your burn rate. And then look at here, followed by hand hygiene. So it's just washing your hands. So let me just back up a second. So I hyper focus on this PPE shortage because there was a certain state so you get your rules from the CDC, you get your rules from CMS. The state did their job. They're like, hey, this is what you can do. And then they wrote in their letter, and you can reuse, but they never put the asterisk for if in a shortage of equipment supply. So individuals across the state thought they could go room to room. It was just bad. So it's a lot. I'm not judging. They're also going to make sure that the supplies that you need, you may have them, but what if they're in the rooftop or in the basement in a locked room? Are they accessible in the actual resident care areas, the units, right? So they're definitely going to interview the staff. They're going to ask them questions. Where do you get your PPE supplies before you render care? Do you know who to call if you run out? Do you think that you have a sufficient supply? If you don't have enough, what is your procedure? And what is the procedure that the organization is using to address, the issue? So they are going to talk to the people. So the source control, obviously, is that residents, visitors, and others in the building are wearing appropriate And again, in accordance with national standards, they're not, because they know it changes, and it does change, and it has changed, and we don't judge. Now, I am going to write here contact precautions, droplet precautions, airborne precautions. And then after I do this slide, I will go to the questions. Because I see a lot of questions coming in. Contact. If I touch you by touching someone, right, you're going to wear gloves and you're going to wear a gown before you touch contact with the resident. If it's droplet, that means that the healthcare professional will put on a mask and eye goggles, face shield, when they're within 6 feet of a resident and prior to entering the resident room. I will emphatically tell you that this is where they will have a field day with, you may know what to do, but if you don't do it in the right order and you don't do it in the right time frame, they will get you. Now, I want you to think of, when I talk about droplet, and then I go to airborne precautions, the airborne, if my camera worked, I would show you my periodic table, but the airborne and droplet means that the molecule is bigger than an airborne precaution. An airborne precaution, like tuberculosis, can linger in the air, so it's light. Droplet means it's heavier, it's a bigger molecule, and you're talking to someone and you see that piece of spit coming out of their mouth and it goes out trajectory and it falls on the table, right? So droplet, it's a heavier molecule and it's going to fall. Airborne means it's going to linger in the air, and I give tuberculosis as an example. And I will say SARS, the SARS that was from 8 years ago and in the hotel that went through the ventilators, that would be airborne. And this was a big topic of debate on the news. It became political. I try not to be, I'm not political. I just want to seek harmony. And the question is, if you ask, is it airborne or is it droplet? And many organizations, in fact, the $2 million hand washing facility, I will tell you, I feel really bad for this facility because they worked very hard and they followed their precautions. They had masks, they had shields, and that was just a horrible situation. I called the CMS. I called the state surveyors. I'm like, this is insane. But all right, sidebar. But for you right now, contact is touch, droplet is spit, airborne is lingering in the air. And when you don't know, you are going to use the strictest, which is airborne precautions. Now, remember from last week with resident rights, you cannot prevent any visitor from coming in, but you need to let them know what type of garb they have to put on and the risks of visiting a resident. So I've said this earlier, but if it's an undiagnosed respiratory infection, you're going to follow the highest level of precautions. Okay. And I'm going to, I know I've got questions and I want to listen, I knew coming out of the chute that this was going to be too much, but I do want to do one thing before I do the questions right here, just to give you a feel for the tags. Again, not the training tag, you're being trained right now. So, but did the staff implement the appropriate standard hand hygiene, use of equipment, right? If it's F880, if they did not, okay? Now, we can do a bonus, don't worry. Appropriate resident care for the related concerns under F880. Does the facility have a facility-wide program using the standards education? And again, love this, based on national standards, right? And it's reviewed at least annually. By the way, your facility assessments, make sure you reviewed them by today. They should be reviewed really November 1st, F880. Now we keep going. Did the facility provide appropriate infection surveillance? F880. Did the facility inform visitors when they should enter the facility and inform them of what IP and control to take? So again, this is how it rolls. Did the facility inform residents, representatives, and families of suspected confirmed cases, and along with mitigating actions in a timely manner? F885. Remember, I started with those slides and I told you I'd fill those in for you. And is the facility in compliance with requirements for staff and resident testing? F886. The red is the new. Prevent the growth of Legionella and other opportunistic waterborne pathogens in building water systems. Measures to prevent the growth. When do you get your water tested? When do you get your water cleaned? What type of chemicals do you add in them? How frequently do you do that? And I'm going to keep. Did the facility store, handle, transport, and process linens properly? What do you do with your linens? Did we talk about that transition room? Did the facility, there's only about 18 of these. Did the facility conduct ongoing review for antibiotic stewardship? F881. Did the facility designate at least one qualified person? If you could do one thing from this call, if you do not have an infection preventionist identified, and they could be full-time or part-time, who is that person? Identify them. F882. You ready? Did the facility provide the vaccinations, appropriately for residents? F883. Did they, this is for flu and pneumonia. COVID-19, F887 immunization. Do you have policies and procedures for your staff vaccinations? F88, and it goes on and on. So what I'm going to do is, and this, like I said, this is not we do definitely do like training on this, but I literally could not. This is 500 slides. I will 100% cut this down for this section, but I'm going to just go through risk assessment. This is from our competency. But let me just see that those are just going through those core elements, which I gave you. And sorry, I'm just zipping down just to see if anything passes to my eyes. And then I'm going to answer questions. And I always have like a clock issue. It's 5:02 in Boston, Massachusetts. And let's see. Where do I go? Where am I going? Let me go to questions. All right, 1 second. So give me a second. Okay, so let me now go here. Oh, good. So Marie says the CDC has some good videos. They have okay, South Dakota. Great state. I was just there. We also have a site through the South Dakota Department of Health called SD Project First Line that has awesome resources with posters and interactive things. And that's good too. Like, again, you don't want to recreate the wheel. I'm going to stop the recording because I know people have to go and I don't want them to feel stressed to stay, but then I'll stay on for answers and questions. So let me just do that first. But in closing, if you want CEUs, you have to complete the quiz. You have to fill out the speaker eval, and that will be available in a couple of days. So thank you so much. I'm going to just stop this recording for you now, and then I'll go to questions. So let's see. Yes.